Joining News Watch 12 today to discuss Jackson County's increase in coronavirus cases is Dr. Jim Shames with the county's health department. Dr. Shames, thank you for joining us again today.
My pleasure. Glad to be here.
Dr. Shames, besides the high number of cases being reported recently, are there any trends that you're seeing that are particularly alarming?
That is the trend that is particularly alarming, is the numbers keep going up and up and up. And I think yesterday, Asante reported the most hospitalized patients for COVID that they've seen so far. I think they had 10. I'm not sure what our local Providence numbers are, but all indications are that we're seeing more disease and more serious disease.
Should this trend continue, how soon before we begin to see an impact on our local hospitals' ability to handle these cases?
Well, we are already seeing some impact. I do know that the hospitals had lots of time to prepare for a surge in patients, and I'm quite confident that even if the numbers go up, that our local healthcare facilities can respond to the challenge. But even if we're not overwhelmed, and I certainly hope we're not, just an increased number of hospitalized patients just indicates there's more really sick people in Jackson County from COVID.
Now, in general, how many of those new cases are being discovered through contact tracing?
Well, contact tracing is a way to expand what you know, so that ultimately many of the cases are from contact tracing, in the sense that you have an identified case, you explore who they've had contact with, those that are symptomatic get tested, and then you identify more cases. I don't know the exact numbers, but a significant number of them are coming through contact tracing and contact investigation.
Now, recently, doctors Birx and Fauci are suggesting that face shields or goggles might be considered for people to help slow the spread. Now, how likely is one to become infected with contact through the eyes?
I don't think anybody really knows the answer to that. It's, once somebody gets COVID, it's kind of hard to tell where it came from. It's a mucous membrane. We do know that other viral infections can come through the eyes, so it's certainly a good idea to protect, your eyes, your nose, and your mouth from the disease. In terms of a face shields are fairly protective for virus coming to you. That is to say, if somebody's within your vicinity, droplets from them would tend to stay on the face shield rather than get through to you. Certainly if it's fitting well below your chin and around the sides of your face. It's less effective protecting others from you. It's kind of the opposite of masks, where masks will trap particles close to your face and protect others from you, but a little less effective the other way around. And in a healthcare setting where the risks are quite high, it's not uncommon for folks to be wearing both masks and face shields, which is currently the recommendation from the OHA.
You say that this is a critical time. What are the consequences if people do not follow those recommendations that you're making?
Well, at some point we may lose the tool of contact tracing. I mean, if you can contact trace 50 people and you've got 200, that are infected, and then that continues day after day, at some point you've lost control and you have widespread community spread. And our concern is that that's the trend where we're headed. And I think we still have time to turn this back, but it's going to take a concerted effort by everybody who lives here to do that.
Dr. Shames, as always, thank you so much for joining us today. We appreciate your time.
You bet. Glad to be here.